Welcome to our campus conversation. I'm Beth Little, the Dean for Enrollment Management and University Relations, and it's great to welcome you to the campus conversation today. This conversation is specific to the WVU Potomac State College campus. And as we wrap up the spring semester, it's time to start focusing on fall and what our return to campus will look like. I know that we are all very eager to return to a more normal situation. Our presenter today is our campus president, Dr. Jennifer Orlikoff, and she'll be assisted in answering your questions by Dr. Greg Ochoa, our academic dean, Lucas Taylor, our dean for student experience, and Scott McVicker, our executive director of finance and operations. Before we get started, let me mention just a few housekeeping items. First, we do welcome your questions today and ask that you use the Q&A function that's available at the bottom of your screen. Closed captioning is also available, and to take advantage of that, just click on the CC, which is also on the bottom of your screen. And we are recording this session, and it will be available later on the WVU Return to Campus website, and we'll be sharing that website as part of the presentation. So we'll go ahead and get started, and Dr. Orlikoff, I'll turn things over to you.
All right, thank you so much, Beth. So welcome everyone. I'm so glad to have you here with us today as we discuss our plans for returning in the fall semester. As you all know, we've come through a very interesting and occasionally challenging year this past year on campus with our different modalities for instruction, our different protocols for COVID pandemic safety measures. And so in the fall semester, because we have access now to the vaccine, we are hoping that our fall semester will be able to look quite a bit different. So let me go through some of the plans that we have in place. So my biggest encouragement here is for everyone to get their COVID-19 vaccine. It is our best defense for everyone if everyone can get vaccinated. It will allow us to move to as close to pre-COVID normal as possible. As an institution, our goal is to reach 80% vaccination rate for the university and for the campus as a whole. So that 80% does include faculty, staff, and students. And we will be sharing our success rate in the vaccination on a dashboard so that people will know how far we're coming and getting to the community immunity, as they call it. And if you want to have some local options for the Kaiser campus, go to vaccines.gov and you can find some local options. There are many options. What they're saying now is that the supply of the vaccine is now in surplus relative to the demand. So if you want a vaccine, it is yours for the taking. In the fall, we will still be following all of the health and safety protocols that we had in place, and we'll be following what the CDC guidelines are suggesting to us. But I imagine, we anticipate that everyone will still be having to wear a mask on campus, especially indoors. We will continue with contact tracing when we do have positive cases. There will be quarantining measures in place for people who've been exposed and who have traveled out of state. So those will remain in effect. However, and if you do take the vaccine, then there's a very good chance that all of this, not the mask wearing will stay in, but if you take the vaccine, you will not need to quarantine if you've been exposed to a positive case or if you're returning from traveling out of state. So this is a very big plus that I highly encourage everyone to take the vaccine. Oops, sorry, went backwards. So in terms of academics, I'm pleased to say that our fall semester will begin as anticipated on Wednesday, August 18th. We will be operating in as normal a fashion as possible in terms of the number of on-campus courses, and we'll be having the classes at full capacity. We will also be offering online courses as is standard during a regular semester. So if that's what you would like to select, that is an option for you. And I imagine that some of the faculty members will still want to continue with some hybrid models of courses, which we would support as well. Now, the Office of Accessibility Services will work with students who might need assistance and accommodations relative to this situation. But also the university's ADA coordinator will work with faculty and staff. It is not likely, or it is not definite that people will get the same accommodations that they had before. It could be that different types of accommodations will be in place for people who are concerned with COVID. And the reason for this is because now that a very effective vaccine is available, that would be the first line of defense. And back for students, though, traditional grading scale will be in place. There will be no high pass, pass, fail options for this fall because the transcripts are so important for reflecting the work that a student has done. And graduate schools look for this information. If you move on to a four-year institution, if you're moving on from here, you would want this information. And then also employers often want to know what your grades are. So this is to the student's benefit, to your benefit. In student life, depending on our level of vaccination, but we will be opening more and more the rec center to even, allow, based on enough vaccination, allow pickup basketball games in the rec center. But certainly, it will be open. There might be some limitations depending, again, on the number of vaccinations. And just said that, with limits on capacity. And of course, participation in outdoor intramural sports will likely be an option, especially in the fall with good fall weather. Being outdoors has been proven to not be a transmission hub, if you will. So this will have more freedom with outdoor activities. And then student activities, these will be in person at limited capacity to start with. Again, as we progress towards higher percentage of vaccination, we'll be able to open these up to more and more capacity. We will have certainly a certain number of virtual options. That's always a good idea. And then student protocols will allow student organizations to safely meet. So this would include the physical distancing, the mask wearing, but meeting outdoors. This is also great. We'll have tents up available out on the quad so that people may have their small group meetings outside. And relative to Welcome Week, we will be developing all of these details and we will be sharing them over the course of the summer. So do please stay tuned. But our hope is to have as robust of a Welcome Week with as many activities as possible. For the residence halls and dining services, the move-in dates will be announced this summer. Obviously, if classes start on Wednesday, August 18th, the move-in dates will be prior to that, usually the weekend before, but we might start even a little bit towards the end of the previous week. But we'll share that with you so that you can sign up. You'll be able to sign up for a 90-minute time slot to move in, and you'll be allowed to have 2 helpers to help you move in, of course, with everyone wearing a mask. The dining services will be opening, so our cafeteria and our rapids will be opening up fully in the fall. And if we have enough students and faculty and staff, if the campus as a whole reaches 80% vaccination, we will be able to remove the plexiglass dividers in the cafeteria, which I think would be a great thing to see. So that's a point of encouragement for everyone. We will also have self-serve buffet options and gloves available for use if you'd like. This is all part of returning to a more normal student experience with the cafeteria. And then, of course, the enhanced cleaning procedures will continue, will stay in place, including changing out the utensils that are used for serving every half hour. All right. Hang on, I'm going the wrong direction, sorry. There we go, COVID, there we go. As we did last fall, there will still be a COVID-19 module that everyone will need to take. It has been modified from last year, so all faculty, staff, and students will be required to take this updated module before the start of the fall semester. More information will be coming out about where to find that module. And so, as I said, details will be shared this summer, so please stay tuned. Regarding our campus operations and staff, we are considering the different types of working possibilities with remote, hybrid, or on-site. My hope is that for everything related to student services and student support services, that we will try to be as on campus or in person as possible. There might be some offices on the campus where hybrid or remote would be an option. But for the most part, I'd really like to see our campus return to a full, vibrant, interconnected campus community. And I feel that all of our employees play a big role in the vibrancy of the campus. And for those who would be working either in a hybrid capacity or remote, this has to be coordinated with the supervisor, and there will be a telecommuting agreement in place with the start date, an effective date of the agreement. And all meetings for campus employees and staff, all meetings must continue to include an option for remote participation, either through Zoom, Teams, or even a conference call number that people can call. Just recently, we have stood up the vaccine certification system, and it is expected that all faculty, staff, and students who have been fully vaccinated to verify their vaccination by August 1st. The link is below here. It says myhousing.wvu.edu, and you follow through there and you register. You'll need the dates that you received your vaccination, your first dose, second dose, and which type you got, if it's Moderna, Pfizer, or J&J. And obviously with J&J, you only need the one dose, but you must complete that verification process, because if you do not, it will be assumed that you are not vaccinated by this fall. So please go into that. And for those who are not vaccinated, they will need to do re-entry testing before returning to campus. They will need to quarantine if they've been exposed to a positive case. They will need to quarantine if they return from travel out of state, and they will need to participate in contact tracing. Well, look at that. I just said all that. So just, here's a slide, no re-entry testing, no surveillance testing during the semester, and no quarantine following travel or if exposed. So these are very useful benefits for the vaccination. And I can't impress upon all of you enough that the more students and employees who are vaccinated, and the closer we can get our group to community immunity, then the more likely we'll be able to keep the infection rates low, and we'll be able to lift a lot of the COVID-19 protocols that are in place, and we'll have a more exciting campus life with more activity. So I highly encourage all of you to seek the vaccination if you haven't already. And I do know that there are concerns some people have expressed concerns about the vaccination. And I would suggest that you reach out to healthcare providers to ask for some concrete information, because the safety of the vaccination um, is widely recognized. As Dr. Coben mentioned this morning in a meeting, he said in the United States, 95 million Americans have been vaccinated, and of those, 99.9% have been protected. So it's a very, very slim number of people who could still have the virus after vaccination, but the effectiveness is just so strong. 99.9% is a very good rate. So please be informed so that you know what you're what you're undertaking, because it's important. And with that, I think I will turn it over to, and by the way, and thank you everyone for all of your participation. I really appreciate all that you've done this year to really help us be able to continue to have an on-campus experience for our students and our employees. And it's thanks to all of your efforts with the mask wearing, the physical distancing, the hand sanitizing. So kudos to all of you. We really appreciate all that you've done. So thank you.
Okay, thank you, Jennifer. And I know that we already have some questions coming in, and anyone else who has a question, feel free to use that Q&A function and type your question, and we'll try to answer as many of these questions live as we can. Jennifer, the first question is, are visitors from the community permitted on campus without proof of vaccination for summer 2021 and fall 2021?
So yes, they are allowed on campus as long as they're following all of the safety and health guidelines with the mask wearing, the physical distancing, and and also, of course, not coming up if they are feeling symptomatic.
Okay, and probably this is question I'll throw to Scott. Will additional COVID-19 vaccines be offered on the Kaiser campus through the summer and fall?
Hey, good afternoon, everyone. At this point, the answer to the question is no. We have a very limited staff within our student health center, and they are not on duty during the summer. And so the good news is that there is ample supply apparently in the community through the health department, through the various pharmacies and other outlets. So while we will not have it on campus, there will certainly be ample opportunity and supply for you to be vaccinated through community services.
Okay, and next question, Jennifer, for you. Will the university continue to provide Zoom access for us to use virtual meetings as an option?
My understanding is yes.
Great, okay. And then another question, and Jennifer, we'll start with you. If there are multiple waves during the summer of COVID-19 infections for populations under 30 years old, will the campus consider stronger restrictions?
Over the summer, was that the question?
Right, if there's multiple waves of additional COVID-19 infections over the summer, especially in populations under 30 years old.
Right. So yes, of course, we will be monitoring the situation very carefully. And if there are outbreaks or waves, especially locally, then we will definitely have to take those into consideration. And that's why everything that we shared today is really subject to change depending on the actual situation. It's just that we're trying to plan this way because this is our desired goal. But if there are other circumstances with other waves of infections, then yes, we'll have to take those into consideration and modify our plans perhaps accordingly.
And next question, Jennifer, I think again for you. Will events be permitted to be held on campus with community members or for community members during summer 2021 and fall 21?
So yes, we are opening up venues on campus for outside groups. again, with the physical distancing in place and the masks, I mean, we are not letting up on that. The only caveat, if you will, are groups where there will be singing and playing wind or brass instruments. But otherwise, groups can gather and meet if they'd like. We won't be hosting banquets or having banquets, at least not the way we normally would, but perhaps if we needed to have self-contained or served meals, we could consider that. So, but yes, we will have options for community members.
Okay, and Jennifer, probably this next question start with you, and you may want others to join in as well. How are vaccinations being encouraged for students? Are we making an active effort to make sure they get the shot before returning to campus in the fall? And will we be able to know which and how many of our students have been vaccinated when we teach in person?
So we will be keeping track of the percentage of campus vaccinations as an overall aggregate number, and perhaps we would know also what percentage of the students, but I'll let Scott talk to that. But there will be communications over the summer, again, encouraging students to take the vaccine because these variants that are out especially in West Virginia, are affecting the 19 to 35-year-old population at much higher rates than others. And so we really, for their safety, for the student safety, for your safety, we'd really encourage you, appreciate it if you could take the vaccine. But Scott, do you want to add anything?
Yeah, I think we are working with Morgantown because they have created the system that is going to be tracking the number of people who have registered, stating that they have been vaccinated. They will be validating or verifying that information, and they'll be sharing that information with us. And so we will know the quantity and we'll know our percentages. And then because of routine testing, we will have to know the individuals who have or haven't been vaccinated, because they would be subject to return to campus testing, and they would also be subject to surveillance testing throughout the semester. So the answer to your questions are, again, we're encouraging people to get the vaccine, because the more people who get vaccinated, the closer we get to pre-pandemic activity. And ultimately, that's a very good incentive. And we're hoping that people will roll up their sleeves and help us get there.
And Beth, I would just like to add that the question was, are we making an active effort? Part of the question was, are we making an active effort to get students to get vaccinated? And as was described in the slides, that is the reason there's an incentive for students to get vaccinated, because the more they get vaccinated, the more we're allowed to decrease that capacity. So to be full capacity in our rec center, to have more capacity for students and organizations to hold events. So that is the real way that we're pushing students to get vaccinated.
Okay, and I don't see any more questions, so if anyone does have a question, if they want to drop that into the Q&A function, we'll be glad to respond to that live. And Jennifer, otherwise, I'll turn things over to you to see if there's other remarks that you want to share.
So as Greg just mentioned, the greater the percentage that we have of vaccinated employees and students on campus, the more we'll be able to relax a lot of these limitations, potentially even not having to wear a mask outdoors on campus. That will be a nice plus. So really, I do encourage everyone to take the vaccine and to reach out, though, if there are concerns, questions, because there's a lot of misinformation out on social media. So if you want to have the right information, be sure to consult your medical provider, or we can put you in touch with healthcare professionals who can answer your questions. But if we all pitch in and do our part, we will be able to beat this virus and get back to a more normal situation. And this is actually a worldwide issue at this point, because if there are countries where people aren't being vaccinated, and so this is why we need to encourage as a global effort. Apparently variants can come through, and some of these variants might be ones that we can't deal with our current vaccination. So I think we can, if we can all just pitch in, do our part, encourage others to be vaccinated, then we will be able to return to normal. It was kind of funny. I had a really interesting dream last night. I dreamt that there was a big meeting, and then in the middle of the meeting, and I wasn't part of it, I was watching it, someone said, okay, now it's time, we can all just hug each other. And so so we all ran around hugging each other, because we haven't been able to for all this time. So I can't express enough how much I'm hoping that everyone will partake in this, so that we can return to normal and have normal dialogues with people in close communities. That will be great. So thank you for your part.
Okay, and we do have a couple additional questions, and we have time, so we certainly want to take those. Scott, this first question is for you. If the Novavax vaccine is approved for emergency use by the FDA, will it be acceptable if one gets that one instead of the other 3 that are currently approved?
I think the expectation is that any drug that has been given emergency approval or gets full-fledged approval from the FDA will be accepted. At this point, there are only 3, but if others do become available, then we would fully expect that those would be considered acceptable for our purposes here as well.
Okay, and Lucas, this question is for you. Will student organizations have an opportunity to recruit members in the fall, such as through a student involvement fair, as we've done in the past?
Yeah, absolutely. And we really want to encourage that. So our plan during Welcome Week, probably within the first 2 or 3 days there, is to have kind of a quad fest. Included in that would be a student involvement fair where all of our organizations can be visible, probably out on the quad if the weather cooperates. And we really want to get back to getting students engaged and involved in these student organizations. So that will be happening early on, as you said, Jay, like we did in the past. And I just would encourage any faculty members or staff members that were advisors of student organizations in the past that may have laid dormant this year due to the circumstances, that you would get in contact with Josh Steger or myself and let us know how we can help revive your organization, because that is something really important that we want to get back, is that opportunity to engage with our students in those ways. So really looking forward to that. So if you have further questions or need any other support, like I said, just reach out to Josh or myself.
Okay, and just want to see if there's any other questions that anyone wants to ask at this time. And I do see another one coming in. Let's see, and I guess, Lucas, we'll start with you on this one. Some universities have said they're requiring students in dorms to be vaccinated because of the close living situation. Are we considering this as a possibility for fall 21?
Well, again, I think a decision like that, we would follow with what the Health and Safety Committee in Morgantown decided to do there. As of right now, I'm not aware of that being an option. Not to say that anything is off the table, but as I know it right now, that is not something that we are planning to do. So as situations change, as maybe FDA approvals come through, will that change? I don't know. But we would certainly follow along with what the recommendations of the Health and Safety Committee in Morgantown are doing.
Can I also add one thing? I know that a student in Morgantown had asked this question this morning, like if they are in a room with a person, a roommate who has not chosen to take the vaccine, can they change rooms? And the answer is yes. You can change rooms for a variety of reasons, and this would be one of them. So.
Okay, I don't see any other questions coming through at this time. I do just want to highlight on the slide the WVU Return to Campus website. Certainly keep an eye on that website for new information We'll be continuing to have campus conversations throughout the rest of the spring and the summer to share new information, and certainly both students and employees keep an eye on your email for additional information as well. So Jennifer, anything to conclude?
Just thank you all very much for attending. I really appreciate everyone's participation.
Okay, and again, this session has been recorded and it will be available on the Return to Campus website shortly. Thanks so much for joining us.